Good morning to all. Namaskar. Very good morning. आज हम देखने वाले हैं अष्टांगहृदय, Sutrasthan, Dinacharya Vyayam, and the importance of exercise. ठीक है, कल हम कहा थे we were studying about the Abhyanga. We were studying about the Abhyanga. अभ्यंग के बेनिफिट्स के बारे में हम बात कर रहे थे. शीर श्रवण प्रादेशु तम विशेषण शिलेयत. शीरः श्रवण पादेशु तम विशेषण शीलयत. इसका अर्थ यह है कि सर, हेड, द रीजन ऑफ द ईयर and the region of the foot, that is talu, at this place one should do the taila abhyanga continuously. सर पे अभ्यंग करने से कर्णशूल, शीरशूल और कर्ण के पास अभ्यंग करने से कर्णशूल, और साथ ही साथ में when you doing the abhyanga at the foot, then the shrama, weakness, leg pain, these are the things get decreases, and a good nidra, a good sleep, it's happened by doing the pada abhyanga. तो पाद अभ्यंग करने से पाँव का दर्द, साथ में पाँव में आने वाली स्थिरता, निद्रा, ये प्राप्त होती है. तो हमेशा अभ्यंग के बहुत सारे बेनिफिट्स देखे जाते हैं. इसलिए अभ्यंग ये हर दिन सुबह, तैल अभ्यंग हर दिन सुबह करना ये कभी भी अच्छा काम होता है. इट्स वेरी गुड. इससे त्वचा मुलायम होती है, शरीर के हड्डियों में स्थिरता आती है. विशेषता जब आप तैलाभ्यंग when you doing at the abdominal navel area, the agni which is disturbed or irregular getting normalized, get स्थिर अग्नि. बहुत सारे लोगों का अग्नि अस्थिर होता है, जिसके कारण अन्न पचन ठीक से नहीं होता, उनको खाना ठीक से नहीं जाता, भूख ठीक से नहीं लगती. बट बाय डूइंग अ तेला अभ्यंग एट एब्डोमिनल रीजन, मैं हमेशा कहता हूँ कि तेला अभ्यंग at navel area, at abdominal area, always benefited for the purpose of good agni, good appetite, and for the growth of the body. That is very important. अभ्यंग करने से त्वचा में मुलायमता, सॉफ्टनेस, त्वचा का टेक्सचर, and many what you can say, the many diseases regarding the twacha rog is also getting removed. Kapalasti, the kapal astiya, and the ear, nose, throat, ENT. So this kapalasti, when we're doing the abhyanga of a shira, there is methods of doing the abhyanga of a shirasthana at the head position. First of all, when you're putting the oil on a talu region, just by rounded massage at talu region, then at the bhrumadhya, then this kapalasti, then shankha pradesha. This marmasthana, you have to be put at this marmasthana. All blood vessels, many blood vessels are in a complex structure, are in a plexus structure. So when you're doing the at Marmasthana massaja, that should be in a rounded way. In this rounded circular way of massage at the Marmasthana of a Shankha, Fana, Bhrumadhya, Stapani, Kapal. Kapal should be in this direction, Kapal Marma, like this. Okay. Then Karnasthana, Vitapa Marma, Apanga Marma. Okay. Now just above the eyebrows there is Apanga Marma and Vitapa Marma at the ear, at the just above the ear sthana. So the middle ear, outer ear in this region, and the pinna, that pinna should be abhyanga with a proper oil massage. That's makes the good circulation of a blood at this region. Many times we always didn't follow this circulation, and that will create the shirashula, karnashula, and sinuses disorders. So these are the good benefits of abhyanga of shirasthana. So where do not to do the abhyanga? वर्जो अभ्यंग कफग्रस्त कृत संशुद्ध अजीर्ण भी, ऑफ कोर्स जिनका अग्नि ठीक नहीं है, यानी कि जिनको अजीर्ण हुआ है, वोमिटिंग जैसा फीलिंग हो रहा है, ठीक है, जो कफज विकारों से ग्रस्त है, लाइक पीनस, प्रतिशाय, नेत्र रोग, कंजक्टिवाइटिस, ओके, कर्ण रोग, कर्णस्त्राव, in this type of kafaj vikara, you should never go with the abhyanga. Okay, try to avoid abhyanga in this case. So in this case you need a swedana. You need a swedana, a proper swedan chikitsa. You must need, by means the kapha which is accumulated over this area get diminishes and get comes out very easily, and the medicine treatment also followed properly. तो इन दिस वे इन प्रतिशाय आदि कफज रोगों में, या जिन्होंने शरीर शुद्धि के लिए वमन विरेचन आदि क्रिया किया है, तथा अजीर्ण रोगग्रस्त रोगों में भी अभ्यंग नहीं करना चाहिए. Why after Vaman Virechana, why in Vaman Virechana, before Vaman Virechana we doing the Abhyanga, the Taila Abhyanga all over the body, that's Snehana. But after Vamana and after Virechana, why we not go for the Abhyanga? Because Balahani is most probably happen in Vamana and in Virechana Chikitsa. Lots of Vamana patient get weakness, Virechana patient get weakness, and after the, and in the Abhyanga Chikitsa also lots of energy is putting on the body by doing the massage and all the, so that is the Balahani. So always avoid after Vamana and Virechana Chikitsa. What Acharya Sushruta has tell that Krutta Samshuddha Dehastarveva Nishiddha, अर्थात जिसने कृत संशुद्ध क्रिया, संशुद्ध क्रिया मीन्स वमन एंड विरेचन क्रिया, वमन आदि जिस दिन प्रयोग किया हो उस दिन, वमन आदि जिस दिन वमन आदि विरेचन क्रिया किया गया हो वहां अभ्यंग नहीं करना चाहिए, उस दिन अभ्यंग नहीं करना चाहिए. नाउ टॉकिंग अबाउट द व्यायाम. लाघवम कर्म सामर्थ्यम दीप्तो अग्निमेधसः शयः. लाघवम कर्म सामर्थ्यम दीप्तो अग्निमेधसः शयः विभक्तम घनगात्रत्वम व्यायाम दुपाजते. व्यायाम करने के बारे में उन्होंने कहा है कि व्यायाम करने से क्या फायदा होता है. व्हाट इज द बेनिफिट्स ऑफ एक्सरसाइज और व्यायाम. द बेनिफिट्स ऑफ व्यायाम आर लाघवम. आफ्टर डूइंग द व्यायाम वी गोट लाघवत्वम, हल्कापन फीलिंग होता है. बॉडी जो स्टिफनेस होती है बॉडी में, वो स्टिफनेस कम हो जाती है. स्टिफनेस गेट्स रिड्यूस्ड, lightness, the feeling of the lightness, and the Agni is getting stimulated slowly, 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 slowly. By increasing the warmness in the body, warm up, we usually told that we're just doing the warm up. But by doing the Vyayama, the warmness increases in the body, blood circulation getting started, Agni getting stimulated, enlightened, and because of Agni, again the Srotorodha is getting removed, and by doing the continuously Vyayama every particular time, then look, the consistency is very important in this case, friends. You just don't go with the one day Vyayama or a daily 1 hour exercise is always helpful. Now, for a how long time you should do the exercise, it's on your capacity and it's on your bala of the body or your prakriti of the body. But I usually told everyone that daily 45 to 60-minute exercise for yourself, for your body, is very, very important. What exactly happened by doing this exercise? And always do exercise with empty stomach. You can't go with having a food and by running. This is not happened. Okay, so what exactly benefits we got? We got the lagavatvam, lightness. The srotoroda get removed, Agni get enlightened. Okay, karma samarthyam. Karma samarthyam. The body has the energy to do the work. Body has the energy to do the work, and that energy it increases. Your capacity of energy is increases by doing the exercise. Karma samarthyam. Increase karma samarthyam. By doing regularly Surya Namaskara. By doing regularly at the first stage you can't able even have to do the exercise by 5 Surya Namaskar also in continuously in a one breath. But as soon as you going further day by day, you start with the 6, 7, 10 Surya Namaskar, 15, 20 Surya Namaskar in a one breath, and you get started. Okay, so this Lagavatvam Karma Samarthyam दीप्तो अग्नि मेदस शय, अग्नि का अग्नि प्रज्वलित होता है, enlighten of अग्नि. The many times the people who having agni mandya, भूख नहीं लगता है, we didn't have a proper food, so the dipto agni medasa shaya, those who have a lots of amount of fats, meda, all over the body, abdomen, atibhara, okay, weight gaining patients, exercise is the only solution in loss of weight. What happen in fat loss patients? Many have a very crash diet, strict diet, and all these things of diet regulations for weight loss. That's important. You just have to follow that. You just have to not to take a snigdha guru anna, snigdha guru madhur ahara. That is the moral of the diet control in the weight loss. The guru madhur snigdha ahar you should not to have. Why happen? What happened by doing this thing? That the quality of meda is not increased. Body will utilize the meda inside the body for the purpose of the energy. मेदशय के लिए गुरु स्निग्ध मधुर आहार का आपको सेवन नहीं करना है. By doing the regular exercise, medashaya is happened. So to weight loss, ahar, nidra, proper nidra is very important. 7 to 8 hour nidra is important for weight loss. It is important for to remove the PCOD. It is important for the diabetes. All are the disease of the medo vaha sutasaha. PCOD, diabetes, thyroidisms. These all are the dushti of Rasavaha and Medavaha, Srutasa dushti. So to clear the channels of Rasavaha and Medavaha Srutasa, you need to do exercise regularly. And you should have a proper diet and proper nidra. Diet, okay? Then these are the three pillars: ahar, nidra, brahmacharyam, tridaha, upastambaha. What about the brahmacharya? Brahmacharya means the exercise of controlling your indriya, exercise of controlling your panchanendriya, karminendriya. You should have control on your mind, on your indriya, on your buddhi. That is the brahmacharya. Vivakta ganagatratvam vyayam upajayate. विभक्तम घन गात्रत्व, गात्रत्व में गात्र लार्ज इंटेस्टाइन बॉडी, ठीक है, उसमें अगर घनता प्राप्त होती है, उसमें अगर आपको ऑब्स्ट्रक्शन उत्पन्न होता है बाय डूइंग द लॉट्स ऑफ many people don't have the many people having a constipation, malaavastamba. So this mala is having a ghana surupta. So vibhaktam ghanata, उसमें जो घनता है, उसमें जो मल है, उसको विभक्त करने में व्यायाम उतना ही इम्पोर्टेंट काम करता है. एब्सोल्युटली. आचार्य चरक हैज सेड, शरीर चेष्टा या चेष्टा स्थैर्यार्था बलवर्धिनी देह व्यायाम संग ख्याता मात्रया तम समाचरित. जिस शरीर चेष्टा से मन को आनंद प्राप्त होता है, जिस शरीर चेष्टा से शरीर में स्थिरता प्राप्त होती है, जिस शरीर चेष्टा से बल प्राप्त होता है, उसे व्यायाम करते हैं. सो इन योर क्लिनिकल प्रैक्टिस यू शुड टेल एवरी patient should follow the Vyayama. It's very important to follow the Vyayama. Vyayam it is not the exercise of your daily routine, it is the need for your body. It is a need for your body. We should be follow everyone every day. I always said, if you bath every day, isn't it? Everyone bath every day. Everyone bath every day. Everyone exercise every day. If you don't exercise every day, you cannot be bath every day. You have a daily lunch and dinner, you should have exercise every day. Those who don't have a lunch and dinner every day, those who have a langhan, they cannot do exercise because they're already doing the exercise Vyayama of a langana. Langana is a type of a Vyayama. Okay? So what in which diseases we should not allow the Vyayama, like Vata Pitta Mayi Balo, Ruddha Ajirni Chatam Tyajetam. Those who are a Vata Prakriti patient. Krusha. Vata Prakriti means the vitamins get those who have a Shayavastha or Balahani, Balashaya patient, weak patient, Maunsashaya, Medashaya patient, 40 kg patient, 35-year-old patient having a weight of 40-45 kg, already in a Bharashaya. So there is no need of exercise. There is a need of Abhyanga. Those patients having a Pitta Prakriti, very hyperactive patient. Hyperactive. Ati Krodha, Ati Lobha, Ati Moha. Hypotemper patient. Okay. Some children also is a very hypertonic. Their activity is very hypertonic. In that case, the physical exercise is less important than you should tell this special child to do the exercise of swimming for the special child to control their hyperactivity moments. The swimming exercise is very important to get that special child to calm down. Okay, and ruddho. But even I usually say to ruddha patient, I understand the concept of the shaya avastha or the dhatu shaya avastha in the age of 70 to 80 years. But if the patient having a good diet, a patient is having a understanding the agni of his body, everyone should understand his prakriti is agni, and having a diet according to his agni and prakriti. There is only a one formula that to understand the agni, that if you're having a food and understand you're having a food, and after the complete digestion of that food, then only take the another food. या लेकिन अंडरस्टैंड, पहला आहार डाइजेस्ट होने के बाद ही दूसरा आहार लेना चाहिए. तो हाउ कुड यू अंडरस्टैंड दैट माय फर्स्ट डाइट इज गेटिंग डाइजेस्टेड completely? Like you having a breakfast at a 9 a.m. and take every half hourly 2 sips of water, warm water, continuously, till you get a feeling of lightness and feeling of hungriness of second diet. If you get a burps, if you get a burps by taking a regularly water in a half hourly for 2 to 3 sips of warm water, you will get the burps. If you're having a smell of your earlier food in the burps, you get to know that yes, the food is still in the stomach. But when you're starting the burps of just normal vayu, then get understand that yeah, the food is completely digested and you will be getting hungriness again for the next food. So I'm talking about the ruddha vyakti or vata prakriti patients. Okay. No, vata prakriti is more hyperactive than pitta. You can say both are a very vata prakriti and pitta prakriti. Both are in a very strong conditions patients. Vata prakriti patient is very chala avastha. They are thinking multiple things at one time. Even if you even the vata prakriti patient talking with someone, in the back of the mind he's thinking multiple things. He's hyperactive in his mind. He's very active. He wants to do multiple things at one time. He's very energetic, chalatmak. But at the same time, by doing this exercise, he getting very weak at very early stage also. He Vat Prakriti doesn't have a control on his movement. At one time he do multiple things, or at one time if you give one work to him, he will put 100 and 200% in this work to complete that work. He go beyond his capacity in the Vat Prakriti patient. But the Pitta Prakriti patient, Pitta Majja, Pitta Prakriti patient is very heat patient. Agni is very Tivra. Ati Raga, Ati Krodha, Ati Lobha, Ati Moha. Everything is Ati. So I will say Pitta Prakriti is slightly more hyperactive than Vata Prakriti patients. Their Prakriti is good, their body structure is good. But in the case of Vata Prakriti, their body structure is Shina, Hina, Lean. Their Agni in Vata Prakriti is Visham Agni. Sometimes they get hungriness in 3 hours. Sometimes they get hungriness in the 5 hour. But in Pittagni, Tikshnagni, quick, within a 2 hour they get again they got the hungriness. Very hyperactive. They can't bear the hungry. भूख को सहन नहीं कर पाते. So Pitta Prakriti patient is more hyperactive than the Vata Prakriti. Okay. So कितना व्यायाम होना चाहिए? How much exercise one should do? अर्धशक्त्या निषेवेस्तु बलिभिः स्निग्धभोजीभिः शीतकाले वसन्ते च मंदमेव च तदो अन्यदा. क्या कहा है? What did they said? बलवान तथा स्निग्ध पदार्थों को खाने वाला मनुष्य शीतकाल में, हेमंत शिशिर ऋतु में एवं वसंत ऋतु में अर्धशक्ति व्यायाम करें और अन्य ऋतुओं में और भी कम व्यायाम करें. लुक, हेमंत, शिशिर and vasanta, like from Diwali starting from October, November, December, January. Okay, so the October, November are the hemanta, December, January are the shishir, and February and March are the vasanta. Hemanta, shishir and vasanta. October, November, December, January, February, March. In this 6 months, the Sheetakala getting started. And as soon as Sheetakala is getting started, getting peak, and again getting down at the Vasant Rutu. But still in the Vasant Rutu, in the early morning, the Shita, now you can see the February, March Mahina, the February and March Mahina is in the Vasanta Kala is going. And now slowly a Grishma Rutu is getting started. Okay. But in still Vasanta Kala, the kapha, in early morning, the coldness, the Shita Kala is still you feel. The climate is very good in early morning from 5 a.m. to 8 a.m. You still having a cold climate in the Rutu. In the middle of the east of the country, you will still feel the climate is very cold, very nice in the Sheet Kala, in a Vasanta Rutu. And of course, in November, December, January, February, this 4 months also you will find the very good climate of a Sheet Kala. So in this condition, understand the karma samarthya of your body. Understand the capacity of your body. If your capacity is of doing a 20 to 30 Surya Namaskara, a proper Surya Namaskara. Not just doing this Surya Namaskara, you have to be, every posture of Surya Namaskara should follow with extension and proper control of breath. When you bend, take a breath, leave a breath. When you go down, take a breath. When you take the posture, take a breath. When you're releasing and again moving to the next posture, release the breath. Vyayam is the understanding the breath exercise. Taking a breath, leaving a breath. But sometimes many people are doing the exercise in one breath. That many times makes the muscle more contracted and having an injury in the muscle. When you're taking the breath, muscle get contracted. When you release the breath, muscle get relaxes. When you're taking the breath, the calcium ionic exchange happens in the muscle. When you release the breath, potassium ionic exchange happen in the muscle. So that's the most important concept of the ionic exchange in the muscle happen during the breath in and breath out. in the exercise procedure. Okay, that you have to understand very properly. Neither you should have an injury in your muscle, a catch in a muscle, a contracted muscle get contracted very longer time. Mostly skeletal muscle get contracted. Okay, so how much vyayama should you do? Understand your sharir samarthya and do the exercise of ardha shakti samarthya. But I usually tell that if you got a sweating on your forehead, if you got a sweating on your forehead, stop the exercise. That is okay for me. When you walk in a cold climate, you didn't find the sweating in your body, but walk till you got the sweating on your forehead. In Grishma Rutu, lots of Surya Narayana showing you the darshan still start from the morning around 7 a.m. The Surya Narayana giving you the darshana. And when you start going to for a walk or for the exercise, within a few minutes you got the sweating. Stop the exercise. Alpa Vyayama. That is a more important concept in the Grishma, Varsha, Sharada, Rutu. Grishma Rutu, summer season, start from the April, May, Varsha, June, July. And in Sharada, you will find the Varsha Rutu, you will find the slightly climate, cold nature, and sometimes summer. So the Sharad Rutu is a mixture of the many Rutu in the middle of the country, like Maharashtra, Madhya Pradesh, Bhopal, Uttarakhand, in this region. Okay, तम कुत्वा अनुसुखम देहम मर्दय समन्तत्थ. व्यायाम के बाद करने का कर्म क्या है? व्यायाम कर लेने के बाद संपूर्ण शरीर का अनुलोमन सुखद मर्दनम कर्म करना चाहिए अथवा सभी अंगों को मसलना चाहिए. Now what happened nowadays? Ayurvedic Panchakarma cleaning become a massage center. People feel that this Panchakarma means massage center. No. Understand first of all. To my all Ayurvedic fellow student, you must understand that Ayurvedic Panchakarma center is not a massage center where you will find the different types of massage. No. This is not a spa center. You are opening a Ayurvedic clinics. Ayurvedic clinic means Ayurvedic Davakhana. You are dealing with the true patient and you are dealing with the true treatment. Many people feel that, yeah, this is only a massage. I feel very great by doing the massage. No, we are not doing massage. We are doing snehana, abhyanga, pad samhanana, pado abhyanga, shiro abhyanga. We doing this type of abhyanga for different types of disease the patient is feeling and having. But along with this abhyanga, one should have a proper medication, one should have proper diet, one should have proper exercise should be advised, and one should have proper medicine should be advised. Without understanding the Prakriti and Koshta and Agni of that patient, you should not advise any Abhyanga to anyone. Understand the Prakriti, understand the Koshta, understand the Agni of that patient, and go follow with the proper diet, exercise with that patient, and along with the proper medicine. If the patient having a Shirashula, that might be due to the increase of Pitta dosha or increase of Vata dosha. So decrease the Pitta and Vata dosha by having a good diet and mild exercise and along with the proper medicine. You should, for pitta dosha, you can use you can use lagu sudh shekar, bhunimbadi kashayam, falatrikadi kashayam to decrease the pitta dosha. If you're talking about the angamarda, body shul, in that case, there may be an increase of vata dosha. You can use the dashamularistam, punarnavadi kashayam, that type of medicine to that patient. And along with the bala tailam, mahanarayanam tailam, abhyanga you should advised. Sometimes nasya also you can advised. So this type of proper complete treatment can be happen in Ayurvedic treatment. That not happen in spa center. They should give you the massage, different types of massage, variations of massage. Even they might be don't understand the 100 marma also. Where are these marma? Ayurvedic physician or the Ayurvedic therapist should know the every marma, every 108 marma, where they are situated, and at where you put the pressure in a in abhyanga or pada abhyanga, or in, because at the sole of the palm of your foot also multiple various venous plexus are there. By putting the pressure on these venous plexus at your foot, you will find the effect in the koshta and in agni. Just by doing the foot massage also, the agni get enlightened and you feel very lighted, and your hungriness or the samata get reduced. So these are the many concepts are behind the abhyanga and vyayama. One should follow the properly. And always remember that if anyone comes to your clinic and told about that, yeah, I need a massage. So you should always tell them that, did you know your prakruti? Did you know your akoshta? Did you know your agni? How is the structure of your body? Did you know that? Did you know which type of diet you should follow? How much exercise you should follow? Did you know? If they don't know, then tell them to follow and get to know about it. And then we will go through with the Abhyanga. Abhyanga is not the Mardanam. But after having a Vyayama, body get contracted, body gets stiff. After having a exercise of walking around 3 to 4 kilometer or 5 kilometer in a run, or if you're having a 100 or 150 Surya Namaskara, then body gets stiff, body get contracted, calcium ionization getting contracted. So you need a potassium ion to release from the cells, and that time you need a Mardanam Abhyanga. Mardanam. Body should be pressed and Mardanam should be done. By which, by the Mardana, muscle get relaxed. So the variation of massage of the Mardanam is away from the muscles, not inside the muscles. It is away from the muscles. You need to remove the potassium ion from the cells. So the away from the muscle, there should be massage, and with putting a pressure. If it is a bicep, you should be away from the muscles, putting a pressure from start to end. This type of Mardanam. Mardanam can be followed with the fingers and from the mushti. In the mushti also, mushti, the circular mushti massajam is also one of the type of the pain, one of the type of Mardanam. Sometimes the thumb massage is also usefully going in this way, away from the muscles, away from the muscle. This type of Mardanam massajam is very useful after having a high exercise, of high contractive exercise, and that will release the pain. And after that, in that, after, have a Swedan chikissa, steam bath. In that also, which type of steam bath, which type of Svedana you should go. Different medicines should be used in the Svedana. Sometime Dashmul Bharad also used, sometime Nirgundi also used, sometime Jeshta Madadi Kashayam is also used. Many Vata Har Shamana medicine has to be used. Sometime Erandamula is used, right? It's just not a water vaporization steam. It is a medicinal steam should be used. That is the difference between the massage center and the Ayurvedic, because we treat the patient. We have a responsibility of patient to treat that patient. Tam krutvanu sukam deham mardetam samantanta. That's what they're saying about it, that. Okay. Trushnashaya pratamatko raktapittam shramam klama ati vyayamatam kwasas jura sardi chajayate. Ah, many patients weight loss treatment, okay, or some athletics who having a 10 to 15 kilometer a day walking or running, or many weight loss patient doing the exercise continuously for a longer day, more than 20 to 40 days. I always told that you should understand your prakriti. Your prakriti is vata. After having a exercise, you should have a proper food. You should have a proper food, what we call a prathina, guru snigdha ahara. After having exercise, to remove the rukshata, jala mahabuta getting out, sodium chloride is getting out after the exercise, more sodium chloride is out, there should be an electrolyte imbalance. So you should have a diet with having a sodium and chloride inside. You should have a diet with having a prathina, that is a protein, after the exercise. But if you not follow the proper ahara, then you might have a shaya avastha. You might have a vata prakopa. You might have a angamarda. You might have a shwasa, kasa, klamata, chardi. Okay, and that leads to shaya avastha. So one should follow the proper diet after having a good exercise regularly. Even if you are walking for a 1 hour, even if you are doing the exercise for the 1 hour, then also you should follow the proper ahara. That is the difference between the dietitian and Ayurvedacharya. Ayurvedic physician having the knowledge of every herbs with their potency, with their rasa, virya, vipaka, which will understand the prakriti of the patient. We know Suntha is Madhur Vipaka, good for the kapha and Vataharaha. Okay, and we know the Sunthi can be used for the Vata and Kaphaj patient. We know the Chitraka, we know the Methi, we know the Amalaki. Many patients are taking the Amalaki Rasa daily basis. Many patients taking the Lauki Rasa daily basis, Tulsi Rasa daily basis, Belapatra Rasa daily basis. Is it fine? Is it good for their body? No. Tulsi is a Vata Kapha Haraha. So those patients having a Vata and Kapha Prakriti, and they having a disease of Vata and Kapha Dushti, they can have a Tulsi and Suntha. Those who are a Vata Prakriti patient, they doesn't have to follow the Amalaki Rasaha, Aula Rasaha. Okay? Why not? Because this is a Kashaya Rasatma. Kashaya Rasatma increase the Vata. So many people who are taking the Amalaki gooseberries juices in daily basis, they might have the pain in knees. They might have a pain in knees. Nimapatra Rasaha. Nimapatra Rasaha daily basis can be good for the diabetes, for the Tikta Rasaha, but it is harmful for heart. It is harmful for heart. Lauki Rasaha, it is also harmful for heart. They increase your palpitation. They increase the sweating. So one should know your prakriti, and according to that, you should take the diet in a morning or in a whole day. Neither you will feel sick, and that will again remove your energy, and you will be get kasa, jwara, chardi, and sometimes rakta pitta type diseases also. Rakta pitta, like the blood is moving from your anal canal, blood is moving from your nose. This type of rakta pitta disorders can happen. Okay, so whom, which patient should avoid the exercise? Those who are doing jagrana. So the exercise which are the activity which are doing in a body by increasing the vata dosha, like jagrana, not sleeping properly, those who are having a more workload in a day, because those who are driving a lot, those who are working a lot, those who are doing very hard work in a day, they don't need exercise. Those who are doing ati vyavayaha, do you understand vyavayaha? Ati maithun shakti, they don't need vyayama. A teacher who are talking a lot in a whole day for 4 to 6 hours, they don't need exercise, they need a sleep. Those who are doing a very hard work, they don't need exercise. Vyayama jagrata dhwaja striha hasya bhashadi sahasam gaja सिंह इवाकर्षम भजनंती विनश्यति. ऐसे जो लोग ज़्यादा एक्सरसाइज करते हैं, हार्ड वर्क करते हैं, और ऐसे एक्सरसाइज हार्ड वर्क करने वाले या अति व्यवहाय करने वाले लोगों को, जो अति हास्य भाषण करते हैं, ऐसे लोगों ने एक्सरसाइज करने के बाद ऐसा कहा है, the condition is just like a lion is trying to pull the elephant by his power. What will happen for that lion? Just think, the lion is trying to pull the elephant by his power, an elephant just not to move, it just not to move an inch also. So by doing this type of exercise, by doing exercise with more exercise, the body will finish. It become urshataha. Urshataha. Shata disease. Shata means shaya. Shaya means raje eshma. Dhatu shaya. Balahani. And mrityu. So friends, today we will stop here. And tomorrow we will talk about the tomorrow we will talk about the acharana. Acharana, which type of acharana, and we might be talk about the vega. Vega. We talk about vega. Okay. So till then, thank you very much. Thank you for your time. Thank you for listening to me. And do follow our channel, subscribe our channel. That motivate us to do regular basis of these lectures. Thank you very much, friends.